It wasn't removed, but she cut me up badly.
What do you mean cut you up badly?
Immediately I was told I had cancer. It was for me a death sentence. Like, now I'm done, you know, and you're like feeling like you're so useless. After 4 sessions, I was sent for an ultrasound to see how the tumor is behaving. Unfortunately, it was still the way it was. Chemo is harsh, it's rough. I knew that the tumor had been removed. I was discharged knowing the tumor had been removed. I went home, but I still went home with questions. I kept on asking her, you had informed me that when I come out of hospital, I'll have a dream.
Did you miss me again? I asked that question. All this while, if you never follow me on LinkedIn, you will think that I was hiding somewhere. If you don't follow Health Focus with Amy on TikTok, again, you will be shocked where we've been. We have been here. We have been checking on patients. We have another guest who went through this journey of cancer. But I'm so impressed and so happy that having gone through the treatment, she has a positive story. It is about patient affairs. Help me welcome on set one of our guests who will get to hear her story from so much pain to victory. Thank you so much for agreeing to be part of us today. Karibu Sana Health Focus, where we have all healthcare matters addressed. Kindly introduce yourself to the viewers.
Nice to invite me to the show. I'm grateful. My name is Nelly Mora. I've been battling cancer of the breast. My diagnosis came sometime in late 2021. And yeah, it was a long journey. And I'm glad to be here to share my story.
Awesome. Yeah. I hope it will encourage somebody. Tell us back. How did it start? What were the symptoms? How did you get the diagnosis?
That was a bit, it's like I found it by fluke. What happened is that from around 2021, late 2021, what happened is that I don't know whether it's related, but it coincided with me getting a vaccine for COVID. I delayed getting the vaccine until sometime in October when work-related assignment demanded that I had to be vaccinated. So I did get the vaccine. They were 3 weeks apart. A month later, I became very sick. I started having a lot of pain on my left arm. So even walking, I would feel so much pain. I just wanted to walk when I'm holding my, you know, like I just wanted a support for this left arm.
So sorry to cut you short. Yes. Were you vaccinated on the same arm?
Yes.
Oh, okay.
Yeah, so when I went to a nearby clinic where I live, they said it could be an infection. Yeah. So I was given medication for pneumonia. Then after a month, now that was around December, going to January of 2022, the pain came back. Oh. Yeah, so again, I went to the health center and told them the pain is back. But this time around, I told them I am a cancer patient because around 2009, I was diagnosed with stage 1 cancer of the breast.
Oh.
Yeah, and I went through the treatment, which was surgery, lumpectomy, called breast conserving surgery. After the breast conserving surgery, I did 6 sessions of chemotherapy. After the 6 sessions of chemotherapy, I was never advised to do anything further. So I went on with my life. I knew I was okay. Early 2008.
Yes.
Early, I had a swelling almost at the chest. So my partner said, this could be worrying. Why don't we go for a test? I did a mammogram. They didn't show anything, so they told me to do something called FNA, fine needle aspiration. So the sample was taken After a week or two, I went to collect the results. That's when, even at just going to collect the results, I sensed there could be something, because I was told, who have you come with? You must come with someone. Then there was a counselor in the room, a nurse, and the doctor, and then they said, like, we found out that you have cancer. Okay. Yeah, so, and you see, by that time, I'm just being told you have cancer. So what, do you have insurance cover? I remember that was a question that I was asked. I said no. Then I didn't have insurance cover. My employer was paying for our hospital bills in case you're admitted. But for outpatient, you'll cater for your own needs. So I told them, we have this arrangement in case of admission, that's when the employer pays. But when I'm not, and then it's like, I think you'll need to go for a mastectomy. I'm like, what do you mean? And like, yeah, we must cut off the breast. Then I said, give me time to think about it. So later there's a colleague I went and told, and I'm a journalist by profession. So my colleague had done a story on health focus, and she had interviewed this oncologist. So she told me, there's an oncologist, maybe you could also go and see her, so that she gives you her second opinion. So I went to the oncologist, so she did, again, she advised further tests, then they saw, then she sent me to the surgeon, a very nice surgeon, Dr. Bernard Dungo. I don't know if it's okay to mention his name.
If it's a good Bernard Dungo Daktari, kudos.
Yeah. So Dr. Bernard Dungo was the best, I think the best doctor I've had in this journey. So he looked at it, assessed it, then he said, we will do a breast conserving surgery because the scans and the whatever show it is stage 1. I'm told it was, there's a term they use in grading. It was in situ, as in it was localized to this place. It hadn't moved.
Awesome. Yeah,
so we went to Kenyatta National Hospital, did the breast conserving surgery. Again, a very nice experience at Kenyatta. Yeah, I'm saying it was nice compared to now the later diagnosis over the years. When I compare the later cancer journey and the previous one, I will say the previous one was excellent. I met very good professionals from the oncologist, the surgeon, the nursing. The theater. It was good. Yeah, it was very nice. The theater, Kenyatta was good.
So we have good care out there.
Yeah. So after the surgery, then I was put on chemotherapy, 6 sessions. After that, I was told I'm okay.
How was the experience during chemotherapy?
It's an experience I wouldn't wish on even my worst enemy. It's not a good experience. Chemo is harsh, it's rough. It's really, my hair, I lost all my hair, I darkened more, I had nausea, vomiting, and I remember the first chemo, it was the red liquid.
Yes.
You know, it gets into your body and you feel like your needles are piercing you all over, from the head to the toe to everywhere. Oh, yeah, that feeling.
I can imagine it.
Yeah, but we went through it, we managed, we thank God. Our Almighty Creator is awesome.
Awesome.
Yeah,
awesome.
We remain prayerful. He walked with me the journey, and after the chemo, the 6 sessions, I was good to go, but I also, along the way, I had an uncle who introduced me to a lady who was also giving me some supplements, which were herbal related.
Awesome.
Yeah, so I regained very fast. Even my employer, you know, at some point, I used to insist to go to work. After chemo, after 2 days, I'm at work, and my boss was like, I've given you time to be away. Kindly, again, my boss, thank you so much, Mr. Hiram Musheke, wherever you are, and Mr. Waithaka Waihenya. Those were my bosses at KBC, where I was employed. Yeah, they were, in fact, Mr. Waithaka Waihenya was so empathetic.
Wow.
He was like, he will tell my friends, kindly tell her to just stay home to rest. But you see, when I'm in my own space, I'm feeling sorry for myself. I felt like coming to work was
for company,
a way
community,
of therapy for me.
Yeah.
And it still made me feel useful
Yes.
and productive still,
Yes.
because there's a way this disease, you know, because I'm telling you, like, immediately I was told I had cancer, it was for me a death sentence. Like, now I'm done, you know, and you're like feeling like you're so useless. And, you know, like when you're told now the only way is mastectomy, we have to remove. Then now later you come through this treatment. And you still feel like I need to just be seen like I'm okay.
Oh, yeah.
Yeah, so I was struggling, I was fighting to just remain relevant. Yeah, and I think it helped in the course of the journey. So that was 2009, 2010. By 2010...
No, you did 6 rounds of chemo. Did you do radiotherapy?
No, unfortunately I didn't do radiotherapy.
It was not necessary, or you just...
I can't remember being advised to do.
Okay.
Yeah, so I stayed until now. I even had 2 children after. They are now 10 and 11 years.
And you never went for a checkup again?
Imagine, I didn't. I think that was careless on my part, maybe, because
No.
when
Were
I was
you told that you need
maybe you know, some of these things you don't need to be told, especially when you're already exposed. I don't know. I can't really remember
why you didn't.
I don't remember why I never even went for even those annual checkups. You know, the way they say be checking those October months. Yeah.
Any lady who is on any hormonal family planning, any lady who has had history in the family, or it's good manners, any lady who is 18 years and above, kindly start having your yearly health checkup. It eliminates all these medical bills you encounter when a disease is stage 4, 5, 10, if we have such a 10. It eliminates something that you could have abolished long time ago. And for anybody who has been treated of cancer, please, can I use the word in Swahili, jipende? It's so painful, it's so stressful, but just take a step and do that checkup every year. Let's proceed. You didn't do you did chemotherapy, you didn't do radiotherapy, you rested. You are well, you are fine, clean bill of health, back to work.
Yeah.
Until COVID.
10 or 11 years later.
Yes, it is.
Because 2010 is when I finished everything to do with the treatments.
Up to 2011.
No.
2021.
2009 is when I finished treatment. The diagnosis was 2008, because I remember 2010 I was okay. Because I was back to work and covering the constitution, Manenos and stuff like that. So 2010 I was okay. 2009 is when I finished treatment. Because now 2012 I had a child. Yeah, I had a daughter in around June. So I was okay. And somehow, for some reason, I was never on family planning. I tried putting the coil, but it didn't work with me. So, yeah, so I was not... I think maybe because of having a child, breastfeeding, I'm thinking I'm okay.
You're fine.
Yeah.
So for the purposes of people will ask a question, when you've done lumpectomy is partial removal of the lump in the breast. Does that breast still breastfeed? That's a question people will ask who are scared, if I get this, I can't breastfeed my children if I'm young.
I breastfed them and they're healthy.
Awesome.
They're very bright in school. I don't know.
Awesome.
I've not had any issues with them 12 years down the line.
It's for them.
Yeah.
Those who are asking. So let's move to back to 2021.
Yes.
You've had your COVID vaccine. Your arm is in pain. You've taken antibiotic. It is back again.
Yes.
You've gone to the health center.
Yeah, now I'm explaining to them I have a history of cancer. It was a nearby health center in where I live in my neighborhood. So when I had a history, then she decided to do a lot of checking now. Then she's like, I think I felt a lump. I'm referring you to an oncologist. So she referred me. I decided to go back to Kenyatta. That's when I went to Kenyatta. I went to the premium care area. I managed to get an oncologist, Dr. Nderitu. And Dr. Nderitu also checked and he said, I can't feel a lump, but if someone did, the only thing that can determine is tests.
Scan, yeah.
So there was blood. There was a CT scan of the chest and the abdomen. There was mammogram. There was MRI. Yeah. So all those tests I was to do. The mammogram showed nothing. The CT scan chest showed nothing. MRI showed nothing. Mammogram showed nothing. But now in the blood is when they saw I think something alkaline something. They said there was some abnormality in the blood which needed to be determined further.
Yani mammogram showed nothing.
Nothing.
Wow, give us the story.
Yeah, and you see, as much as my cancer was labeled a breast cancer, it was in the infravascular. It was somewhere here.
In the
So that is
region.
yeah. So that's why mammogram can't, because it's not in the breast.
So,
it was here somewhere, almost at the neck.
So the breast, so the
But the-
lumpectomy was done here or in the breast?
These two cancers for me, I don't think they were related. The lumpectomy, the cancer was here near the breast, not on the breast, but near the breast.
Just at the breast tissue.
Yeah, the breast tissue.
But
even
now the second one is the clavicular region.
yeah,
Okay.
yeah.
Wow.
But it was still called breast because they were saying some. I think
There's a certain
veins-
communication.
Yeah. So that is why all those things, I guess, were not capturing it until
Yes.
now. When now after the blood is when the oncologist said, "I think I need. Where is the pain?" I said. Then he said that we are going to do a guided ultrasound.
Oh yes.
Yeah. So through the guided ultrasound, that is when now they saw a tumor growing.
At this region.
At that region. So from that now is when I went for biopsy. So the biopsy came back and it showed that I had cancer. And
At what stage at this?
the biopsy didn't grade it. I don't know, I didn't understand the name, but but then I was not told about the grade and the stage. I was just told there's cancer. Yeah, then the oncologist I was seeing then said, okay, this cancer, I'll send you to the surgeon to see if he can remove, then we start chemotherapy. So I was sent to a surgeon, again a very nice person, Dr. Hungu. Then he looked and he said, I go for a marker. Like they put a beacon kinda on that tumor.
To see
Because
the
he
margins.
said the intravascular, he feels like we should do chemo first to shrink it. And then after shrinking, now the marker or the beacon will remain. It will show where, in case the tumor shrunk forever, as it has shrunk, the beacon will remain. So we'll know that was the diseased site. So I went for the beacon, it was put successfully. Then he said, now you start your chemo. When you're done, we will come back and remove that part. So I did chemo. After 4 sessions, I was sent for an ultrasound to see how the tumor is behaving. Unfortunately, it was still the way it was.
Shrunk.
It had not done anything, and you can imagine being through all that. You know how chemo is, eh? And the chemo journey is also a very draining one.
Draining, lonely, and painful journey.
And emotionally, financially,
Yeah.
it's quite draining. And especially if you have to do it in a hospital where there are many patients, you need to book. You need to be there by 5 so that you are not. Then you get there. Sometimes you find there's no medication. I remember the second chemo when I went, I was told, unfortunately, the medication is not here. So you woke up at 4 to be there at 5. Then you're in the queue. You're told, I'm sorry, your medication is not here. So do you have 28,000 you go by? And it has been approved. I was using NHIF then, civil servants. So you're like, where do I get 28K? And
it's like go by.
And again, which chemist will I go by? And I'm alone in the queue. So I'm going to look for medicine, Yonikuje. Anyway.
It's like you go by Patco.
Imagine. You know, like.
Yeah, sorry. We can laugh now.
So, yeah. So that experience made me leave that hospital and said, let me go back and look for another oncologist. So I ended up in a private hospital, a small establishment, where now I resumed the chemo from there. And then after the 4 sessions, he's saying, it seems that your particular kind of cancer, because it's estrogen positive, it never responds well to chemo. So he advised I just go straight for the surgery. Then after surgery, because now, even now, the PET scan showed that the tumor had moved. So it's at stage 4. So
Was it at the lungs only or another?
it had moved to the lungs, and there were no nodes seen elsewhere.
So it had gone to stage 4 now.
It had gone to stage 4. So it's like even chemo. I remember him telling me, we're not now even pursuing curative, we're now on palliative. So just managing it, yeah?
As we wait for you to transition. That's the statement you hear.
He did say, so I asked them, so palliative means this is done, like, he said not necessarily, people associate palliative with Nini, but it's just to manage it. That's what he said. So I went back to Dr. Hung. Dr. Hung looked, we booked to do the surgery. Then because I'm using NHIF, they requested, I don't know how much they requested, but NHIF rejected and said it was on the higher side. Then there's some friend of mine at NHIF who told me, why don't you try second opinion, maybe another hospital? Then even me, I'm like, okay, maybe let me try, because I'm always used to second opinion. I never like go with the
first opinion.
But I think that was a bad decision I made, owing to the experience I got thereafter, because I went to second opinion. I found a nice surgeon. He looked at the scans, he looked at the place. He told me, infravascular is rarely operated on. But because these scans have not been done at our hospital, they'll need to be fed in their system, but now it involved costs, and I'm broke. And NHIF is saying, you know, NHIF doesn't pay for second opinion.
No, it doesn't.
I didn't have the money then, so I said, let me walk to the next hospital. So I walked to a neighboring hospital in Parklands. Then there I found a surgeon who was so eager. She was like,
to cut.
This one, we will do it, it's
Remove.
good. Yeah. She was so eager and she convinced me.
And you removed?
It wasn't removed, but she cut me up badly.
What do you mean cut you up badly?
I went through the surgery. I knew that the tumor had been removed. I was discharged knowing the tumor had been removed. I went home, but I still went home with questions. I kept on asking her, you had informed me that when I come out of hospital, I'll have a drain, to drain liquid.
Yeah, yes.
But I'm not with a drain, I'm just, what?
Okay.
And then even after surgery, they again through NHIF, the request was made. The request she made, was rejected. So I said, maybe I should not. Then she called me and told me, no, we have adjusted the request. So I told her, I hope I not top up. She's like, no, this will be enough. Only for me to be given 3 times the billing of the surgery. So I had to chip in through, and you know, I'm being given the bill in the evening, post-surgery. I've been discharged. In the morning she came and told me I've been discharged. Me, I'm thinking now I'm going home by 1. Only for someone at 3 to tell me, a relative came to see me and I'm telling them I was discharged, but no one is telling me anything. Then she comes and tells me, she goes to inquire and then she's told, the bill is here. When I see the invoice, she had requested 350,000 and I was brought her bill of 700,000. It was 780,000.
How do you get that money now? Fundraising.
I had to fundraise through friends, through Mshwari, KCB loans. I had to look. And then I didn't even mind. My disappointment came 2 weeks later when I'm going to review to my oncologist. There's something weird she was doing. When I went 2 weeks post-surgery, she's telling me, now I'm referring you to another oncologist, another hospital. He will follow you up. And I'm like, I came here from my oncologist. Surgery. You're taking me to an oncologist I don't know. She's like, you just go as I've said. And I'm like, okay, so what is the result of the surgery? She's like, you know, we did not remove the residual tumor. And then I'm like, what do you mean you did not remove the residual tumor? And your doctor will explain to you. I'm like, so what happened exactly? So I had gone with my brother, and then I told him, okay, he went to the lab to get my result, the things, you know, after the surgery, the sample, the
lamp,
everything. It was being taken down. They didn't even want to give him the results. So I had to go and ask them, what is the problem? I said, your doctor must approve. So I'm like, but this is mine. I was
It's your
discharged from your hospital. Yeah.
report.
Then later is when I was given. But my whole experience at that facility was so bad. Sometimes listen to your instincts. The day I was admitted, do you know, I went to the hospital at noon. I was being given a bed at 8 p.m. Meanwhile, I've been kept in the corridors. Nini, I am tired, I'm hungry.
The Lord has been telling you, go home.
At 8 p.m., I was packing to go. It's a cousin of mine who accompanied me to hospital was insisting, no, let's just remain, Nini. But me, I was like,